What is distortion? Distortion is the second of two geometric properties that affect radiographic image quality. Distortion is a misrepresentation of the size or shape of the object being X-rayed. Today we will discuss the two types of distortion, size distortion and shape distortion. This graph is a great visual of the properties that affect size and shape distortion. It shows that size distortion is affected by SID and OID, and that shape distortion is affected by the alignment of the central ray, the part and the image receptor, and also the direction and degree of angulation. First, let's talk about size distortion. So what is size distortion? The only possible size distortion in radiography is magnification because of the divergence of the beam. The factors that control magnification are SID and OID. This X-ray is an example showing the difference between an AP and PA chest X-ray. The first X-ray in image A shows the PA chest with minimal magnification of the heart because of a smaller OID and larger SID. The second X-ray in image B shows the AP chest X-ray of the same patient with greater heart size magnification because of the increased OID. As this picture shows, to reduce magnification, the goal is always to have a small OID and a large SID. And if you're saying, well, what in the world is OID? OID means object to image receptor distance, and SID means source to image receptor distance. So having a small OID means getting the part that is being X-rayed as close to the image receptor as possible. Having the body part as closest to the image receptor as possible reduces the magnification. That's why it's so important to have the body part right against the image receptor and not farther away from it. The second factor that controls distortion is SID, and it's always better to have a larger SID. Having a large SID means that the distance from the central ray to the image receptor is as far as reasonably possible. For example, a chest X-ray is performed at 72 inches as opposed to 40 inches so that the heart will not be magnified. Next, let's talk about shape distortion. Shape distortion is when the object being X-rayed is not true to its original size and is either elongated or foreshortened. Elongation is when the object appears to be longer than it really is, and foreshortening is when the object appears to be shorter than it really is. This picture shows how all shape distortion happens due to either the misalignment of the X-ray tube, which is shown in image A, the body part being X-rayed is improperly positioned as shown in image B, or the image receptor is not centered properly as shown in image C. Now let's talk about the central ray as shown in this image letter A. This image shows the central ray projected perpendicular to both the anatomical part and the image receptor. When the image receptor is not perpendicular, there will be some amount of shape distortion. The second way distortion can occur is improper alignment of the anatomical part. The long axis of the anatomical part or object is intended to be positioned perpendicular to the central ray and parallel to the image receptor. The last way distortion can occur is if the image receptor is not aligned properly. The image receptor is intended to be positioned perpendicular to the central ray and parallel to the anatomical part. This picture shows how these errors in alignment can affect the image. Elongation is shown in image C. Elongation happens when the X-ray tube or the image receptor is not aligned properly. Foreshortening is shown in image B and happens when the body part being X-rayed is not properly aligned. The last thing we need to talk about is tube angulation. Tube angulation is used to prevent different body parts from being superimposed. The most common direction of tube angle is longitudinal. There are two types of longitudinal angles. One is cephalad, meaning to angle toward the head, and the other is caudad, meaning to angle toward the feet. Angulation must be compensated for with a new SID, or IR exposure may be affected. The degree to which the tube is angled is also important. The degree is just the amount of angulation between the X-ray tube and the image receptor as measured from the point of perpendicular. The degree of angulation can also change the SID and can cause magnification. If distortion is present, it affects the quality of the radiographic image. As technologists, we should be genuinely concerned with the accuracy of our images. Our patients' lives will depend on the diagnostic quality of the images we provide to their doctors. If the image is of inferior quality, a medical diagnosis can be missed. Having images that are distorted is not in the best interest of our patient, so understanding all the ways that distortion can be avoided is important in order to give our patients the best images possible.